affected by many variables, and there is a variety of avidity reagent which can differ based on the phospholipid source, the activator type, also the source of the factor deficient plasma, and so on. So when we look at the comparison between the one stage and the chromogenic assay, I'm just giving you snapshots of one or two examples. So this was an extended half-life product. Here the potency label is by the chromogenic assay and the chromogenic assay from hyphen gave expected values, while with some avidity reagent there was gross underestimation. Silica-based reagents gave lesser value, while ellagic acid-based reagent gave true value. Now, with respect to electate, there was not much difference between the one stage and the chromogenic assay. Now, how do we know which assay to use in a particular scenario? So when it comes to recovery of factor VIII, there are different methodologies that you can adopt. You can use a chromogenic assay. For most of the recombinant extended half-life products, chromogenic assay will usually give the true value. Now, most laboratories don't have a chromogenic assay. So what can you do? So you can select the avidity reagent you can do the factor VIII assay with a particular avidity reagent. Now this table shows the different extended half-life products and also summarizes the reagents which are suitable and reagents which are not suitable. You can also see that the chromogenic assay can be used for most of the extended half-life products. Now this is not usually feasible for laboratories to do factor VIII assay by different avidity reagent. Usually they will have only one or maximum two avidity based reagent. So it may not be a practical scenario. Now another option is to use a correction factors. Now especially for this product Abstilla, the product insert itself says to multiply by the factor of 2. That is, if you get a factor VIII by one stage assay is 50%, you need to multiply by 2. This is mentioned in the product insert. But the guidelines clearly say that laboratories should not use correction factors because that is a very artificial way of measuring recovery levels. Versus like principle. So what do you mean by like versus like principle? So when I talked about the one stage factor assay, when you're measuring dilutions of the patient plasma, you're comparing with a standard which is a plasma concentrate. And this plasma concentrate has got normal factor VIII, which is similar to our human normal plasma factor VIII. So instead of using a calibrator with a plasma standard, you need to use a calibrator with a product specific standard. So you can, this is not very difficult. So you need the factor concentrate of the vial of the concentrate which is given to the patient. So usually the unit is 100 international unit per ml. You need to dilute it to bring it to 100 international units per deciliter. Now after that, instead of using the plasma calibrator, you're going to use this. So but the lab needs to know what replacement factor was given, how the potency is set, is usually mentioned in the product insert, and whether the current method of one-stage factor assay that they are doing or the chromogenic assay is acceptable. So this needs to happen with a good communication with the clinical team. Now with respect to factor IX recovery assays, now as opposed to factor VIII concentrate, factor IX concentrate has been assigned potency based on the one-stage assay. So usually the factor IX concentrates are not as complicated as the factor VIII concentrates. But you can see certain discrepancies even with the extended half-life. See which of the avidity reagents or which chromogenic assays are suitable or not suitable for the factor VIII mimetics can be emicizumab or the recently introduced mimate. So what the emicizumab assay is going to bring the factor IX and 10 together. So emicizumab is a bispecific humanized antibody. Coagulation factors. Now you're attacking or inhibiting the anticoagulants, trying to rebalance the hemostasis, more or less what happens in liver disease. Recovery levels. You might need to do a Bethesda assay to quantify the factor VIII inhibitors or monitor the effect of non-therapeutic doses of emicizumab. That is even 3 to 5 micrograms to 6 months after stopping the emicizumab. So what can you do to monitor emicizumab? You can use a chromogenic assay. In the reagents you have factor IX and factor X. Now this can be of human origin or of bovine origin. So the first one, which is the chromogenic kit from hyphen biomed, is distinct from the others because it is purely made of human derived factor IX and factor X. So this chromogenic kit will be able to detect the chromogenic emicizumab effect. But all the others, because they have got bovine based reagent, will not be able to recognize the effect of emicizumab. That is, emicizumab will not bind to bovine factor IX and bovine factor X because in the effect of emicizumab. So this is from hyphen biomed. Alternate commercially along with controls. So if you want to monitor emicizumab, you have the chromogenic factor VIII assay or the modified one-stage assay using emicizumab calibrator. If you want to measure endogenous factor VIII, a patient, so most of the other kits belong to this category. If you need to do a Bethesda assay, again, you need to want to monitor emicizumab, you have the human chromogenic kit or the modified one-stage assay, and monitoring recovery assay, you have the bovine chromogenic assay, inhibitors also using the bovine chromogenic assay kit. If a